Hey, can you hear me?
Hey, yes. Yes, I can hear
Okay,
you.
so I'm gonna make you a host
Okay.
and I'll be just introduce Josh. I know this call is being recorded right now, so and then introduce him and let just see him introduce himself, right, on who he is and what he does. And then the reason why we decided to do this call, and then I'll hop back in as soon as I can. So now I'm just gotta figure out how to make you a host here. Let me just see this. Host tools. Okay. Lock meeting, waiting, share screen, rename, share notes, request the computer, request a host. Oh my gosh, can you click on anything on how to make you a host, please?
Gosh. I'm trying to find this out. Hold on. More.
It's okay. Mm, Okay,
More tool
okay. I don't see. The problem is I'm not on my computer, so I can't.
rename pen. I don't know. Normally, I'm trying to see if there's like a request to be host, but I don't think that
Click on the little three dots that you have next to.
it just says captions, docs, notes, whiteboard, meeting info, reset to default. Uh, Chat,
Oh my
invite.
God. Okay, I will just be on the run. I'm just gonna be on. I'm just gonna let everybody in because I can't figure this thing out right now. And then I mute myself, and then you
Okay.
just do what you need to do. Sounds good?
Okay.
The only issue is that my battery is dying.
Shoot. Well, I wonder if somebody knows how to do this because I'm
Ask to unmute. Sorry, doctor. Um, it's crazy. On
let's
the
wait for
computer,
it.
I know how to do it. Okay. All right, so I'm gonna let you take over, okay?
Okay. Hi, everyone. Welcome. Welcome, welcome. Come on in. There's Josh.
How you guys doing?
We're great. How are you?
Very good.
Good, good. Just letting you all know, Coach Patricia had to go see a doctor. She's getting vertigo. So I will be your host. We're just trying to figure out how to make me the host because her phone is also dying. Does anybody know how to do that?
It's a good question.
Oh boy.
So let's see here.
Sorry, you guys. I am on the doctor's office. I had to come. They squeezed me in. I'm dealing with a very bad vertigo, and I couldn't even function today. So I didn't want to cancel because I don't cancel things. But I'll be listening and I'll hop back in as soon as I can. But I trust you guys are gonna rock this, okay?
Mhm. All right. Waiting for more people to come on in. We'll give a couple more minutes before we get started. Wait, everybody had a lovely Easter. How was the weekend? Anybody?
Too short.
Yeah.
It was so nice. The weather, I'm
It
in
was beautiful. It
Florida.
was beautiful.
Yes.
Yeah, that's nice. I wish I could say the same. I'm up in Canada. It's like our spring, you never know what you're gonna get. You could be hit with really nice weather or you could be hit with a snow bomb. So
Lindsay,
it's
where you
like
at?
I live close to the mountains, Alberta.
What was,
So Calgary,
got it.
Alberta. Yeah. So yeah, usually by May, that's when it starts to get nice, but snowing today.
Oh, wow. I'm not gonna rub it in and tell you that we had 86-degree weather today.
I know, I know. Don't do that. I'll head to a warm place soon enough.
You're here in spirit.
Yeah. One more minute. All right, I think we're going to get started, and I'm sure more people will come on aboard. But we have a very special guest with us today, ladies. Um, we have Josh Thinker. Am I saying that right? Your name
You
right?
nailed it. Nicely done.
Perfect. Thank you. He is from Optimal Wellness Group. We've recently teamed up with them just to help us when it comes to peptides and other hormone therapy things that we're going to be doing with them. So invited Josh to come and speak on a very pertinent topic that we've been looking into and getting into because it's a big thing now, and it's peptides and even GLP-1 too. Um, so Josh is an expert on that level, so we've invited him to come talk to us regarding that. So Josh, why don't you tell us about Optimal Wellness Group and what you guys do, and then we'll kind of lead into peptides and all that kind of stuff.
Absolutely. So, as she said, I'm Josh. We're Optimal Wellness Groups here in Boca Raton, Florida. Um, we do an array of different services, such as peptide therapy, hormone therapy, testosterone replacement, medical weight loss. We have the IV therapy as well. Um, but like I said, across the board, as far as anti-aging, wellness, we even do nutrition. We have a, couple licensed other dietitians as well on board with us. So we try to keep it, across the board, well-rounded with our services. Like I said, whenever you're ready, I'll dive deep as far as the peptides, and there's thousands of them out there. They can be very overwhelming if you start going down that rabbit hole. So when it's time, I'll be happy to dive deeper into the peptide world with you guys and answer any questions you guys do have moving forward.
Awesome. Thank you. Yeah, well, let's dive in. Um, First off, why don't you tell us what peptides actually are? Because there's a lot of
There.
people that come into our program that have no idea what
Yeah,
peptides are, what peptides do. So let's start off there for sure.
absolutely.
And if
So
anyone has any questions too, as we move along this call, please don't hesitate to write in the chat or just unmute yourself and ask Josh a question at any time, okay?
absolutely. So great question. That's usually the first question is, what is a peptide? So peptides are basically small chains of amino acids. Amino acids are building blocks of proteins. So that's kind of give you a generic idea of what a actual peptide is. And like I said, there is thousands of them out there. If you do go down that rabbit hole, you'll see it can be very overwhelming. But you do have, I like to put them in different categories. So like Lindsay mentioned, GLP-1 is considered a peptide. So that kind of falls in our weight loss peptide. There's a few other peptides out there that do fall into that category. AOD is another one, amongst others, but the GLP-1 has been the most popular as of late. But surprisingly enough to most people, it is considered a peptide. We have another category considered growth hormone releasing hormone peptides. Again, a bunch of them out there. Just to name a few, some of our very popular common ones: Somorelin, CJC Ipamorelin, Hexarelin, IGF-1LR3, Tesamorelin. What these peptides are basically doing is sending signals to our pituitary gland to increase our own natural growth hormone production more efficiently. Unfortunately, as we age, our growth hormone production declines, just kind of like a lot of our other hormones and things like that. So what these peptides do is, again, they release our endogenous hormone production by sending signals to the pituitary gland. The importance of growth hormone as we age and it declines, it is the reason for and helps us with burning fat, helps us with increasing lean muscle mass. It also helps with our recovery, sleep, things like that. Um, it stimulates the breakdown of fat to use as fuel. So it's again, growth hormone production is very important, and the fact that again it declines with age is where the implementation of peptide therapy comes into play. Again, there's a bunch of them out there. They all range and different effectiveness to kind of really depending on what you're looking to really do and accomplish. For example, the Somorelin and CJC Epimorelin, two separate peptides, really great peptides. They take some time. So I tell patients usually within the first 4 weeks, you may see some enhancements in your sleep quality and recovery. But as far as the body composition benefits, the anti-aging,
Thank you, this froze. Did I freeze? I had to check. I'm like, did I freeze?
a little bit of step above as far as the peptide's concerned, and so typically see a little quicker results with usually about 4 to 6 weeks. But usually, it says as far as the benefits, usually around the same with the increase in lean muscle mass, the decrease in body fat, and like I said, just the overall optimal well-being. Cognitive function is another one, true benefit as well. We move over, we have another kind of category and tier of wound healing peptides. BPC 157, TB 500. Those are probably the most popular wound healing peptides. They're going to be great for reducing inflammation, also repairing and help recovering with soft tissue damage, tendons, ligaments, bone healing. I can't tell you how many patients I've had come in either post-operation, post-surgery, getting on the peptides that sped up the recovery process. I've had patients go on it going into surgery to keep the inflammation down before going into surgery. And then I just have some, I've actually had a few use them to try to bypass surgery. I had a patient had already tore his ACL in each knee once, tore it again for the third injury. He was really not looking forward to going through a whole nother surgery in the recovery process. So he was trying to find a way to kind of maybe bend around the surgery. So we put him on the BPC and TB together. And I followed up with him, and he actually was continuing his exercise with limitations, but was able to kind of get around the surgery procedure just by keeping the inflammation down and helping that any kind of soft tissue damage that was and that did occur, helping repair that a bit as well. So like I said, those are kind of the three sections, three tiers of the peptide world. Like I said, there's an array of them. These are just kind of a handful, popular few that we really use the most of. Again, it's a rabbit hole. If you go down there, you're going to find hundreds of others. But again, that's the kind of our more popular ones, the ones we do and work with the most.
Awesome. Thank you, Josh.
Guys, I'm back.
There we
I'm
go.
just not going to be on camera, but can you just fill me in? I apologize, for this inconvenience today, but I didn't want to cancel this call because this call is super important. Um, so just fill me in. What do you guys talked so far, so I can, kind of like direct a little bit to because I have some clients that I really wanted to be on this call today. So anyway, just fill me in a little bit.
Hey
Where
Patricia, it's me, Josh. I just went down kind of a little bit brief summary of the different peptides, kind of
Mhm.
different categories. Kind of gave an example of a few in each category, and just gave like a basic rundown of a few of those.
Awesome. Okay. And Coach Lindsay, you share the reason why we had Josh on this call today?
I did not fully explain that. No.
Okay. All right. So let's just chat a little bit about, the reason why we invited Josh to the call. We have obviously, Josh, we work primarily with women in perimenopause and menopause. And one of the things that, I'm a woman in perimenopause myself, right? So I am on HRT, and we have a lot of clients who are on HRT. And through the years, I've noticed that some women, depending on the amount of HRT or amount of medication they are taking, either progesterone or testosterone, we find that they thrive, they do much better on a reverse diet when we on the building phase. But when we go into the cut, they have a hard time to lose the weight. And obviously, after tons of research, we found that it's a thing, right? So it's harder to lose that weight when you are on HRT. So then I'm like, okay, so what do we do now? What are the options here? Because we all know the HRT is to support happy hormones, how I'm gonna feel, but it has nothing to do with weight, right? So for some women, it will help them to stop gaining weight, but not necessarily lose weight. Makes you, especially if you're on testosterone or I don't know, 200, 300 milligrams of progesterone, you're gonna feel fuller. So so then, the options would be, okay, we can stay off the medication, off of the HRT during the cut, so they could lose some of their weight. But and then I'm not really a fan of that because it can create, hormone disruption again. Your body's just so used to something, and now, you're going to back off when you took it so you could feel better, right? So I'm not really a big fan of that approach. Obviously, I'm not a doctor, and obviously our clients would be talking to their doctors, but I don't think, the doctors would be a fan of that either. So then I was like, okay, what are the other options? And talking to Josh, because I have done the how can I say, the CJC before, and I did see some changes. Obviously, I don't have a lot of weight to lose. I am pretty lean, and using that, it helped a very very little. But and then we had a couple of other clients that got on the CJC. I don't think it was CJC, it was the 157,
PPC,
the BCP,
BPC.
and together with the testosterone. And oh my gosh, one of them was Cymer, and she absolutely looked fantastic. Then we had a few other clients that got on not the CJC. I don't think I had any clients on CJC. The majority, the three that we had was the BCP 157 that really supported, also, lower back pain, injury, and, which is another common thing that I see in women in perimenopause is those kind of, sciatic pain, frozen shoulder, just plain inflammation that is happening in the body overall. And unfortunately, the HRT will not take care of that. We do have different protocols like the flush protocol that helps a lot, but people can't be on a flush protocol 24/7. So, the peptide, my question is, the peptide would be another tool in our box to help this woman during the cutting phase. Could you speak on that?
Yeah, Patricia makes a really good point. So the hormones are just a piece of the puzzle. So obviously very, very important. And again, they decline as we age as well. Peptides kind of tackle a different avenue. As Patricia said, the BPC 157, as I mentioned before, is a great wound healing peptide, reduces inflammation, and obviously soft tissue repair as well. It's also had tremendous studies with gut health. We all have,
Mhm.
I mean, as we know how important gut health is, and the reduction of inflammation within a gut as well. It comes in a injectable form, and we also have an oral form. I always tell patients the injectable is really, I think, the best and most optimal route to go as far as if there is a specific site of injury. But there is an oral form if it is just strictly gut related. Great extensive studies on BPC 157 oral form with the gut inflammation, the GI tract. Um, so like I said, very good peptide along with the CJC, ipamorelin. It's going to fall in a different category. Not really as much the wound healing category, but again, just kind of increasing our growth hormone production to help with, again, increasing our lean muscle mass, decreasing body fat, especially when the diets are getting, very intricate. It's going to help again retain that lean muscle mass and even gain some as well. These are just puzzle pieces. Obviously, diet,
Mhm.
exercise are have to go hand in hand. You're going to get out of the peptides what you put into it. So it's just another tool. It's another mechanism, but they can do tremendous things. I talked to Patricia about her course of CJC up at Moreland. She said she really didn't see too many great results with it, which is fine. Everyone responds to these peptides different. I recommended another peptide to Patricia, which was the Tesla Moreland. I felt it was a little stronger of a peptide. I had a patient use a test more, and she was actually a CrossFit pro. Reduced her body fat and increased lean muscle substantially within the first month and a half. So depending on the patient, depending on their goals, their lifestyle, really kind of navigates which peptide is best suited for the patient. But again, the BPC, great peptide again for just the inflammation purposes. I've had patients they're improved in energy, just
Yeah.
recovery after a workout or after um, the week is over. He said bouncing back from workouts and recovery has been substantially better. Energy has
Yeah.
improved. So
Yeah, I
there's
did
laundry
feel
lists.
though, my skin looked much better, my hair, I slept better. So I had different kinds of benefits from the tesamorelin, not the tesamorelin, sorry, the CJC.
BJC.
Um, you know, just overall, I did feel better. But like I said, as far as body composition, I didn't see much change, but I'm excited to try the tesamorelin. And I know you just shipped out for me, so I'm super excited to try that. But because I became estrogen dominant now, unfortunately, and on this cut, I am weight loss resistance, and I have that pouch that is not going away for the life of me, and I want to try. So I'm like, okay, let's go with that. But I do have some clients, and I'm so excited to hear what you just said right now about the BCP, the 157. You guys have that in pill form.
Correct. We have
Oh
injectable
my
and pill form.
gosh. Okay,
Absolutely.
girls. Okay. Okay, gut health is a big problem that we deal with women in perimenopause and menopause. And I have a particular client. She's not on the call, so I'm not going to say her name, but oh my gosh. But if she's going to watch this, you know who you are, girl. I need you to be on this BCP for your gut because you already did your test with, that company. Can't remember right now, the Viome or whatever. And I think her blood markers, like her gonna say her inflammation markers, is so high.
Very common.
She is very dominant, and we are just like, oh my gosh, I know that we're gonna have to bring some different tools for her because her body is just exploding with inflammation, and we're trying to figure it out. Obviously, this is some kind of autoimmune disease, but we're like, okay, which one, right? So I would love to see when somebody has a really high inflammation like that, Josh, and and they already are, really good with the nutrition and the training. What do we do? Would this how can I say, this peptides be able to help bring that thing down?
Well, you nailed another part of the benefit with the BPC. Not only the inflammation, but there's been studies with the you just said it, um, anti-inflammatory. Would you say, Patricia, the
Autoimmune.
autoimmune disease? Thank you. Great studies with that. Arthritis, a bunch of studies with that as well. Um, BPC 157 is if you're anywhere in that realm, we are walking around with inflammation. We all
Yeah.
have it. It's just to what extent. And like I said, with the BPC and its studies with the gut health, like I said, the reduction with arthritis. I can send you guys information on the BPC. There's a laundry list of benefits with this peptide. Typically taken if it is even either one injectable form or oral form taken daily. Once a day, weekly. Um, but again, oral if it is for gut health, I've seen great results with. For
Hmm.
patients looking for, again, if they're injury specific, I think the injectable form is a little bit better. I have patients
Hmm.
that even if they travel a lot, the oral forms work great because the BPC does have to be refrigerated. So the oral
Mhm.
form has been a little bit better to travel with. But as far as gut health and GI tract, BPC is another phenomenal peptide to tackle those issues.
That is awesome. You know, girls, you know that I'm always looking for, tools. How can we bring tools that are, safe? Okay, tools that are not, that is, that is going to be able to enhance and support because as you already know, um, as you already know, this is not a walk in the park. Okay. Someone, I share a little bit of this on my story today, but you ladies know me, right? I am pretty on point with my nutrition, with my training, with really trying to work on stress management, trying to, how can I say, cross every T and dot every I. And yet, I just tested my I just got my blood work, and I'm sorry, I'm a little bit off because I've been dizzy and I'm having a hard time to put words together because of this vertigo. But I went on a reverse for 8 months, 8 months, and my body was responding great. I was on progesterone, I was on testosterone. Tested my blood work 6 months ago. Everything was balanced, everything was great, no problem at all. And just 6 weeks ago, I got into a cut and I didn't even cut much, okay, because you ladies know we don't cut much right in 6 weeks. So slowly bringing my calories down, and all of a sudden I just or started to developing crazy gut issues again. Okay, I had dealt with gut issues in the past when I first turned 42, and I don't even know if it was SIBO or whatnot, but I was a mess. I felt like I was pregnant every day. It was horrible. The foul gas. I mean, I can't begin to tell you. I went through when I became perimenopause. Um, but back then I didn't know what to do. Nobody was talking about this. It was 8 years ago, right? I was a mess and nobody knew how to help. I thought, oh my gosh, do I have cancer? Do I have a disease? What the hell is going on with me, right? But this time is different, right? So 6 weeks ago I started to get the same symptoms on my stomach, so I knew exactly what I needed to do, what to test. And then I went and I did my blood work as well, and sure enough, I am estrogen dominant. Okay. So no wonder why I lost weight quickly in the first few weeks of my cut, and then my body just stalled. Okay. I have photos that I shared on my stories. Go on my stories and you guys can see. I literally blew up, like blew up. Okay. Inflammation everywhere. Like, talk about frustration and embarrassment right before my wedding. Okay. So, and then on top of that, since last Wednesday, I've been dealing with vertigo from the researches that I've been doing. It can be related to estrogen imbalance and all of that too. So I'm here just to share that, this thing, hormone imbalance and perimenopause is not a walk in the park. It can flip on you overnight. Okay. Unfortunately, it's just the way it is. But we do have the tools, right? I knew exactly who to call. I knew exactly what to do. I knew exactly what tests to take. I knew exactly. So this time around, I am not going to be suffering with this, like I did when I originally had the situation happening 8 years ago. Now I know how to pivot this thing, how to change my protocols. I reached out to Josh, like, okay, let's connect, because what can you give me? What do we need to do in a healthy and safe way? Because there is a world, the peptides, girls, we are behind the 8 ball, to be honest with you, and really learning the benefits of peptides. Like Josh said, we have what is it called, so athletes, so many athletes take peptides to support with injury, to support with energy. And and even people that are now, Josh, and we do have clients on GLP-1. Let's talk about that a little bit too, because it's a battle to maintain that muscle mass naturally when you are on GLP. Do you want to speak a little bit on that as well?
Yeah, that's a great point, Patricia. I know you and I kind of briefly touched on it before. GLP-1 obviously is a very popular peptide right now. I've seen great results. The way I kind of cater it to the patients is my goal is not to get you to the highest maximum dose. If I can get you to your goal weight and get you successful on a low dose, that's where I'm trying to do it. But just like anything else, diet, exercise is key. You're going to get out of the GLP-1 we put into it. But like Patricia said, what one of the big problems and areas I've seen with the GLP-1 and the weight loss, yes, people are losing a lot of weight. The issue comes then is the lean muscle. You want to make sure the weight loss is coming from the body fat, not the lean muscle. And that's what seems to be the difficult task for most people. They're suppressing the appetite to the point they're not getting enough nutrients in, they're not getting enough protein in. So that's why I'm constantly touching base with my patients and reminded them the goal here is not to eliminate appetite. We are suppressing it and curbing those cravings, those sweet desires, those snackings, things like that, the drinking. We're trying to curb those. I need you to eat. You need to get the right nutrients in. You need to get the protein in. We need to make sure the weight that you are losing is coming primarily from the weight loss, the fat, and not the lean muscle. With that being
Mhm.
said, I've seen great results with patients combining the GLP-1 with a peptide like Somorelin, CJC Ipamorelin, things like that. These are
Mhm.
now helping the patients, like Patricia said, not only retain the lean muscle through the course of the GLP-1, but also gaining lean muscle through the course because of the exercise and proper diet guidance as well. I can't tell you, we have an in-body scale at the office. I tell patients not to swear by these numbers. It's just kind of a generic idea of where
Mhm.
they're at. But I'm constantly making sure and monitoring that with the weight going down, it's not coming from the lean muscle and primarily from the weight loss. And the patients that have implemented peptides with the GLP-1 have not only seen the lean muscle sustain, but the ones that are implementing exercise 2, 3 times a week have actually seen an increase in lean muscle, which is fantastic while on a GLP-1, where most
Mhm.
patients are seeing weight loss, but they're calling it the skinny fat, where the most weight is coming from the lean muscle and they're not
Yeah.
losing much fat from that weight loss. So the peptides have been really, really good and really beneficial with that obstacle that most people are having an issue with.
And also, let's talk about, if you, because you know that the GLP can definitely affect the gut, which is such a, it's so interesting because the medication will help with inflammation. I have heard people that, start taking inflammation just absolutely came down and they start losing that inflammation weight, but and then they do have issues with their gut. I honestly am not an expert on this, so I'm trying to understand this myself. So then obviously if peptides like BCP would help them with the gut and the inflammation, so it would be even more beneficial to be on both.
Absolutely, absolutely. So like I said, with doing the GLP-1 with the BPC, just for the GI tract, the gut health,
Yeah.
like I said, helping with leaky gut, stomach ulcers, things like that. The BPC again has great benefits as far. Now, I will say the BPC I wouldn't say will help with the lean muscle portion of it, retaining and gaining the lean muscle.
Hmm.
But absolutely what Patricia said, as far as the gut issue, the gut inflammation, while on the GLP-1, BPC has been a phenomenal addition to the course as well.
Okay. How many peptides can one be without one interfering with the other and the whole thing?
Great question. So that because of the array of peptides, you can do the GLP-1 with a wound healing peptide with a growth hormone releasing hormone peptide. They will not, they interact in our body in different areas. What I wouldn't suggest is maybe doing multiple growth hormone releasing hormone peptides. So a Somorelin with the CJC Ipamorelin with now you're overloading the receptors. It's too much.
Okay.
But if you're doing one growth hormone releasing hormone peptide like CJC, like Patricia mentioned, and a wound healing, which I have tons of patients doing the wound healing and those CJC together, along with your GLP-1, they don't contradict one another. They're working within our body in different ways. Even like I said, with the BPC and the TB 500, there's a lot of patients that are doing those together as well. They have
Hmm.
similar benefits and effects, but there's extensive studies that the combination of the two, because of the different compounds, have been really substantially working great. with combining the TB500 and the BPC157. And again, it really depends on the patient and what they're looking to
Mhm.
accomplish in their goal. Those
Yeah.
those patients are usually battling a procedure, post-surgery, an injury.
Uh-huh.
But again, for more gut health, and for weight loss courses, I think BPC along with your GLP-1 and then a growth hormone releasing hormone peptide is a phenomenal stack. They don't contradict one another. They're working within the body in different areas.
Okay. I love that. And here's the thing, I am not obviously, I just want to be clear with you ladies. I'm not pushing any of this on anyone. I'm just bringing you knowledge and giving you tools so you ladies can, we can make the decision together. Obviously, if you need to lose 5 pounds, you shouldn't be on GLP-1, right? So you could try a peptide, okay, that is going to be much more beneficial for you, because you just do it for 12 weeks. The main reason I'm bringing Josh into this call is because we have noticed as a team that a lot of women still get stuck. They lose some of the weight on the cut, but they don't lose the weight that they used to lose because of the HRT. And we don't want to stop the HRT during the cutting phase. And I think that trying the how can I say, the peptide a while in a cut could be super beneficial. So you are not getting frustrated during your cut, okay, without seeing the results that you want because you are on HRT. Is this making sense? Is this clear to you, ladies? Okay, because I see the frustration. Trust me, I am frustrated myself with my results, but I'm not going to stop my HRT. Does that make sense? It makes me feel good. I like it. I sleep better, and I'm not with as much anxiety. I'm not going to get off so I can lose weight. It makes no sense to me because my well-being is more important. But and then how am I going to lose the weight that I want to lose after reverse? That's why I'm bringing Josh here, because there is an option for that. That's number one. And number two, for those of you that are stuck with so much inflammation, you've done the flush protocol, and when you do the flush, you lose weight, and then you finish the flush, you gain the weight back. What do you think? Why do you think that is? It is because of inflammation. Okay. So we all walk with inflammation, but some of you have high markers of inflammation. So getting into, a gut peptide could be the game changer for you. Could be. So it is a 12-week cycle. You don't need to be on this forever, right? So I think those are the reasons why I'm bringing Josh into this call. Makes sense? Um, I would love to open for questions. For example, I have one here, like I just want to speak on this because she messaged here. Claudia, I was on BPC for about 2 months for gut health, and yes, it helps. Now I think I need to go back on it. So just speaking on that a little bit, Claudia, I think you would definitely, it won't hurt you, absolutely. And I think it's beneficial. Just remember that, another reason why, your gut was off, right, was because of the lack of nutrition. Does that make sense? So I think that, as we build you back up with your macros and with the right nutrients and just making sure we have more variety for your microbiome of nutrition, of nutrients, and then adding that, I think is going to be, the game changer for you as well. Make sense? Anybody would like to ask a question? You have any questions about that? Uh, yeah. Will any peptide affect HRT, Josh?
That was a great question. I was just going to respond. And I get it's a very common question. And like I said, they're working in separate areas of the body. So you have your hormones, so your testosterone, your production, estradiol, progesterone, all those things. Then you have your growth hormone production. So they are working in different separate avenues of the body. So again, another benefit to add to your HRT. And again, I have numerous patients that are doing them together because they are working differently. They actually are working better in conjunction because you are tackling, again, your growth hormone production as well as your hormone as well. So really, really beneficial to use them both. And again, no contradictions with them together. Actually, some of the peptides, more on the male side, it's better to do with the TRT, testosterone replacement, um, depending on the peptide. So, great question. And I would say, except especially the ones that we just discussed, Somorelin, CJC more, and things like that, as a great add-on to your hormone therapy as well, for sure.
Yeah, I took it a while. I was, I've been on HRT and didn't do anything as far as, affecting my HRT. Yeah, yeah. Okay. So I'm excited to, try the test Morellin, and I will share photos before and after so you ladies can see what it's doing for me as we go, because with the high estrogen, I am on Estracort to release that, of course. I don't think I can lean now to the way that I wanted for, my wedding and for the women's conference and whatnot. But some of you ladies, I would definitely like for you to do some, how can we get some resources on this information, especially for those that need the support with, minimizing the inflammation markers, Josh?
Patricia, if you want, I can send you some information on the BPC, and then if you want to kind of mass forward it over to your group, I guess I'm more than happy to share that information. Kind of just get over.
Especially because you have in pill form, right?
Well, yeah, have them both in pill and injectable form, correct?
Because some people are afraid of
Yeah, and like I
doing
said,
shots and whatnot.
yeah, and typically some are, especially with it being new. I mean, it is a small insulin syringe, but again, some people do have the needle phobia. Or like I said, if you're using the BPC for gut health, the oral route is phenomenal. The only ones I'd really try to kind of maybe sway away or sway into the injectable form is someone battling an injury. I just think it's been a little bit more effective. I've seen
Hmm.
it work with patients battling with the shoulder, knee, back, things of that nature. But again, if it's strictly gut health, GI, leaky gut, ulcers, things of that, the
Hmm.
oral route is a phenomenal way to go. Absolutely.
Love it. Okay. Ladies, my girl's a little bit shy, okay, just so you know. They take a while to talk, but anyone that would like to ask a question to Josh.
Yeah, Josh, are there any what are the contraindications for taking peptides?
Which and it peptide specific?
No, no, just in general. Is there
So as far as side effects, I would say the most common that I've seen patients have noticed, um, maybe a little flush after injection. The flush usually goes away. Depending on the person and the compound of the peptide, some have noticed maybe an irritation at the injection site. Um, Depending on your dose, also depending on the peptide, maybe an elevated heart rate. But I had that with maybe one or two patients, and as we brought the dose down, it went away completely. So it really typically correlates to the dosing. But as far as across the board, and most of them are your growth hormone releasing hormone peptides. So the CJC, apomorelin, tesamorelin, things of that. That's where I've really seen some, even the GLP-1s. I've seen patients with kind of like the irritation at the injection site. I don't know if any of the girls have seen and noticed that. Almost looks like a mosquito bite. Typically goes
I
away.
did.
Yeah.
I did, but it started to happen after week 8.
Okay. Yep.
But I noticed that it was because I wasn't changing the locations, more. Like I was
Absolutely.
supposed to, I was doing primarily on my tummy area, and I kind
Mhm.
of had like an allergy effect, right? That it went away afterwards, but it was very itchy. It was itchy, very itchy.
Yep, that's exactly what it is. So sometimes even maneuvering a different injection site that usually takes care of the problem as well. But yeah, as far as side effects, the BPCTB, I haven't really seen really much of anything at all. The GLP-1, really like I said, the injection site irritation. I've seen them a little bit more with as well with the Somorelin CJC. Some patients feel a little flush, maybe like a little like redness, heat in the face. It tends to go away. Some even after a couple weeks on course, they're fine altogether. And then some nothing at all. So it really depends on the individual and also the peptide as well. Um, but yeah, like I said, I see another question here: is BPC approved by the injectable version is in that area where the FDA has taken it and are trying to decide whether to put it back on the approval list. So it's in that, but the oral form has no issues. We actually have quite a few different pharmacies that have the oral compound available. It's the injectable version that, again, it's like this off and on with the FDA trying to decide what they want to do with it. I think that was
Uh,
by
and it's
Shay.
natural
Yeah.
or synthetic.
Yeah, no, it's not. It's not a natural. It is compounded in the pharmacy. Um, but yeah, synthetic, correct.
Okay, thoughts on microdosing GLP for a small amount of weight loss?
I think that's I have quite a few doing that. Most patients, once they hit their goal weight, as I titrate them up to hit that goal weight, I then bring them slowly back down and titrate them off. Some then will stay, speaking about it, a small maintenance dose. So they'll use it as needed, a low dose as needed. So instead of once a week, they'll use the medication maybe every 2, 3 weeks as needed. So yes, a lot of benefits. They'll use it if maybe they see like the cravings, snackings, sweet tooth coming back, then they'll use it then. But I really, really encourage it during that time you're not using it, sticking with the exercise, sticking with your diet and nutritional program. And again, just using it as needed, that small dose if the cravings kind of start rolling back.
Mm. So when you talk about small amount of weight, what are we talking about here?
Well, I was talking about small maintenance dose. So as a patient, once they hit their goal weight, let's say their dose that they ended on was 50 units. I will then titrate them back down, 40, 30, so on, until we find a
Yeah.
good maintenance dose. Then they'll use that small 20 unit, 25, whatever the patient may need, again,
Mhm.
as needed. So maybe 10 every 10, 14 days, depending on the patient and
Right,
how
because
they're
what
tolerating.
Megan was asking is for a small amount of weight loss. So what is
Oh, I see what
what?
she's, yeah. Are we talking
Yeah,
about 5 pounds, 10 pounds?
yeah, that would be considered a small amount, right?
Yeah.
What do
I've
you say
I've
about
had
that?
patients, yeah, they've used it for that 5-10. I encourage the exercise and diet. Once they come back and they've tried the exercise, they've been diligent with their diet, it's just stubborn for whatever reason it may be.
Hmm.
You've put them on a small dose to get that last 5, 8 pounds off that they're having trouble getting off, whether it's for a wedding or event or whatever it may be.
But how does that work though? Because the clients that I do have on GLP, they have to lose a significant amount of weight. That's number one. And I've noticed that we had to get, I had two of them that didn't have to lose much. Both of them had to lose about 20 pounds, but they didn't start losing weight after like 6 months. I'm not kidding. No, sorry, like after 90 days on GLP. So it took 90 days, microdosing, getting the body used to, and then after 90 days, they start to lose weight, but it was very, very tiny, right? It wasn't anything, dramatic. Like I've seen people with a lot of weight to lose, they lose a big amount of weight right off the bat. But for those with 20 pounds, they didn't see much weight loss. Now I have another one. I didn't put her on it. Obviously, I can't do that because people need to go through a doctor. But I'm talking about like having a conversation and say, hey, let's go with that. I think that would be a good option for you. But we have a client that she only needs to lose like 5 pounds, and she went to her doctor. Her doctor offered her because, how can I say, cravings and all that kind of stuff. And she went on it. And against my will, I was like, I do not think you need this. You only have 5 pounds. But she went anyways. And she did lose the 5 pounds, which was pretty shocking to me because the other two that I had that need to lose 20 took them 90 days to even start losing. So what happened there?
Did you, or do you know, did they adjust the dosing at all during that course of the 90 days?
Yeah,
I
they keep
hear,
building back. Yeah,
okay.
they kept building slowly, slowly
Okay,
until they
because
got to a
that's
certain
one of
amount.
the things I hear all the time is, oh, I tried it, it didn't work. And again, it sometimes it doesn't work for everybody. Again, everyone responds these medications, these peptides differently on their own.
Hmm.
So that's to say that first and foremost. But I do find that patients, when we try it, didn't really work. They didn't ever bump up the dose. Whatever dose they started with, they didn't even were aware they were supposed to eventually bump up the dose as they went along. So that's
Yeah,
usually my first question. And usually that's been the case. No, I've been on the dose that I started with. And I'm like, well, that's probably why you never really end up losing the weight as you went on.
yeah.
Was it the semaglutide or tirzepatide? Do you know, Patricia?
Semaglutide.
Okay. So another example is I have patients that have tried the semaglutide and it didn't work. Just wasn't the right medication for them. They then transitioned to tirzepatide, which seemed to see better results with. Uh,
Hmm.
the difference between semaglutide and tirzepatide. Semaglutide targets solely the GLP-1 receptor. The tirzepatide targets not only the GLP-1, but also the GIP receptor as well. So it's targeting two different receptors compared to just the one. So it's a little stronger of a medication. But with that being said, a lot of patients have seen less side effects with the tirzepatide. So not as nauseous, not as constipated, not as much indigestion, acid reflux. So a lot
Hmm.
of times, for your example, Patricia, if she was on the semaglutide, was getting stuck, I probably would have recommended maybe switching her to tirzepatide, a different compound, and maybe a little stronger of a compound,
Hmm.
and see how she would have done with that switch.
Yeah. Yeah, they eventually they lost all the weight,
Oh,
but
good.
it took 90 days for them to arrive, I guess, to the right dosage to be
Hmm.
able to lose the weight on semaglutide. I think that's what the case was. But this one that needed to lose 5 pounds and went on her own to do that, she did lose some weight on the tirzepatide. So anyways, the main concern for me, for someone like that had that had massive gut issues. I'm not talking about a little bit of gut issues. So to go into tirzepatide when you have so much already gut issues, for me, it's a big no-no unless you are doing something else to support that gut. But I can't force people to do or not do things, right? So she decided to do it regardless. But if you're looking for girls, not just how you look, this is the thing that I always coach in the program. This is not just about how you look, right? This is about how you feel. If you're gonna take something that is gonna mess with your gut, why would you do that if you already have gut problems, right? When it comes to the GLP, you gotta do things properly, right? With the flush protocol, with maybe a BCP, what is it called? A BPC, to keep your gut in a good place. If you are taking a GLP and making sure, obviously, that you're doing the strength training and the training, I mean, the nutrition. Sorry, my thoughts are off. But we don't do anything for a shortcut or for a quick fix, right? That's not the purpose. The purpose is what other tools can I bring on top of the strength training, on top of the nutrition, on top of stress management, on top of minimizing inflammation. But what can I bring to add to this? The HRT, right? It's a bunch of tools in our box. This is what I'm trying to bring it here because at the end of the day, these women are getting offered, okay, GLP and all kind of stuff, even at the flipping salon. Like seriously, anybody and everybody's offering them. They go to the gynecologist, they get offered this. They go to the dermatologist. If they complain about anything, GLP, GLP. I'm like, what the heck, you know? It's just very interesting. But let me just answer a few other questions here. Claudia, can you be on BPC OI during the flush? I would start after the flush, Claudia. I would definitely start after the flush. Is BPC approved? Okay, where I got that one. Will any peptide interfere with thyroid therapy, like Synthroid?
Yeah, that's a great question. And I'm glad she brought that up. When you are getting screened for these peptides, it's always important to list the medications you are taking. I obviously will get on the phone and email back and forth and kind of go over that with you during the consultation. But always make sure, like I said, to list the medications. And yes, depending on the peptide and CJ Ciepamorelin, um, being one of them could actually make the Synthroid medication feel stronger. So it can enhance the medication. So it's a very good question. And yes, some of the peptides could maybe not contradict, but actually enhance and make the thyroid medication a little stronger than what you would have with just that by itself.
I love it. Okay.
Good
So
question.
if you take the oral BCP, what dose do you recommend?
Dosing, I believe, is a
BPC.
basic dose is 500 micrograms, and again, it's taken daily. And that can be adjusted as you go along. But typically to start, I believe it's 500 micrograms once daily to start as your starting dose.
How to know if the peptide provider is using quality peptides?
Oh, these peptides are coming. These are all scripted medications. So I have a medical director. He has to sign off on the scripts. They then go into a compounding pharmacy. These compounding pharmacies are regulated, so they better do what they need to be doing and make sure their P's and Q's are on point. We don't get these, and actually, I love that question because it leads me to my other point. I'm sure we all have seen the ads on social media. I know I have. Peptide Science, I think, is a popular one. I get this a lot. It's, you know, if you look at the label of these peptides on these sites that you see, you'll see for experimental use, not for human consumption. That's their
Mhm.
gray area. That's how they're able to kind of push it out to the public without a script, without a medical director overseeing it. Our pharmacies are again FDA regulated. It's a little bit different of an animal, but it's a question I get all the time. I have people send them over to me. Did you see this peptide? Why is it so cheap? And I'm like, well, there's your there's your first red flag.
Yeah.
And again, I have them look at I go look at the label. I go ahead and zoom in and tell me what you read. And typically, it's right there in fine print, not for human consumption, experimental use only. So I advise, look, I can't tell, like Patricia said, I can't tell you what to do. I just tell patients to proceed it with caution. I'm not saying all of them are bad. They say they're third party tested and they go on. Maybe some of them are. But again, they're just not regulated. You don't know what kind of metals they're being compounded with or what else is being, if you're even given the dose that they say they're getting. That could be underdosed. I mean, there's just so many other things that could vary with some of those the ads that you see online. But ours is do come from a pharmacy. They are scripted. They are compounded from an FDA regulated pharmacy. But it's a great question. I get that actually quite a bit.
Okay. So I guess we have one final question. What the prices range on those peptides?
Really depends on the peptide. So, I mean, depends on whether the BPC, whether it's an injectable form, an oral form, and also depends on whether you want to do the other peptides, CJC, Teslamore, and things like that. I already told Patricia I wanted to take care of her group. I'm excited to work with her. You all seem awesome. Again, I'm really excited about you guys moving forward. So you guys will be getting a discount percent off on all your orders moving forward. So Patricia, can be more than happy to give my information to you guys. I'd be happy to speak to you over the phone or through email, and we can go over through the onboarding process, pricing, and everything you guys need to know. And
Yeah, the most important thing, ladies, obviously I don't make a dollar off of this. It's me just bringing a resource to you, an option, another tool in the box. Like I said, um, we create this collaboration with Josh. We have a collaboration with another clinic, but with Josh, I want to stick primarily with peptides. Not that he can't give other things, but because that's his expertise. He's really, really, known for that. So I feel safe to start, this process with him. and then let you know. But if you want to investigate more, just let us know, and then we will make an introduction on the email with him, and then he will take from there and book a call with you so you can see what the options are. For some of you, I would love to see, you, even if you're taking the BPC, it keeps going back from BCP, BPC. uh, even
We're
if
picking
it's
up what you're putting down,
the
Patricia.
right, even if it's the pill form, just to help with your gut, your inflammation. Some of you do need that support, girls. But once again, do your research before you do anything. I think we have one final question there, and we are good to go.
The Puerto Rico patient. I love it. I will have to, it is considered US.
Yeah.
I can't ship international. I say me, the pharmacies can't do international. I've had a few patients that maybe travel to Mexico or Europe or something like that, and we can't. The pharmacies have to be licensed in the state they're shipping to. That's kind of how that works. As far as Puerto Rico, I will double check. I'm not sure, but since it is considered US, I may, it could be a possibility, but I'll definitely double check for you for sure. Fingers crossed for sure.
Just cross. Yeah.
The other one I saw here was are you using what kind of studies are you using to dose for your patients? The pharmacy really gives the recommendations as far as dosing. Again, everyone's different. So we typically go off the pharmacy recommended dose, but it always can be adjusted. I'll use the GLP-1, for example. The pharmacy is recommended usually 25 units for I think the semaglutide or even the tirzepatide. I've even come down a little bit lower for patients to start off, just to kind of test them out and see how they respond, and then bump it from there. And some people are fine with it. So to adjust to the patient, it really, I mean, it's going to have to trial and error almost in a sense, kind of how you respond to the medication. You may need a higher dose, you may need a lower dose. It's kind of going engaging off of how you feel. And the GLP-1 is a prime example. I've had to adjust the dose across the board. And that's even going off of the pharmacy recommendation and their dosage.
Love it. All right. Thank you so much for your time, Josh. Truly appreciate you. Girls, was this helpful? Was this helpful at all? Like, put it in the comments for me. Let me see the love there. Was this helpful? Did it give you some ideas there, some knowledge? Obviously, we can continue, discussing this. Awesome, great call. Love that. Fantastic. Thank you. Yes, yes, yes. All right, awesome. All right, girls. Well, if you wanted to continue this discussion, let me know. Message us. I'll put you in contact with Josh, and we go from there. But I appreciate your time. I know it's late there for you, Josh, and thank you for giving your time here to us today.
Not a problem. I was more than happy. I thank you so much for the invite. You guys were great, awesome questions, and I look forward and very excited moving forward with you guys and working with you.
All right, awesome. Have a fantastic evening. Bye, girls.
Thank you, girls.
Bye.